Every year, millions of people make a decision they believe will change their lives for the better. They walk into a health food store, or scroll through a wellness website, and they purchase something that promises to cleanse their body, reset their liver, flush out toxins, and leave them feeling reborn. The labels are beautiful. The language is reassuring. Words like natural, herbal, ancient wisdom, and plant-based create a sense of safety that feels almost sacred. And then some of those people end up in the emergency room. This is not a story about rare accidents or unusual overdoses. This is a story about a pattern, a growing, documented, medically verified pattern of serious organ damage tied directly to products that carry no warning, require no prescription, and sit on shelves between the vitamins and the protein powders. This is the story of what happens when the word natural becomes a shield that hides genuine danger. In the last decade, cases of acute liver failure linked to herbal and dietary supplements have risen sharply enough to alarm hepatologists, liver specialists, across the United States, Europe, and Australia. A landmark study published through the Drug-Induced Liver Injury Network found that herbal and dietary supplements now account for roughly 20% of all drug-induced liver injury cases presenting at major medical centers. That number was closer to 7% just 15 years ago. We are not talking about a stable situation. We are watching a crisis accelerate in real time, largely invisible to the public because the products causing it are not classified as drugs. To understand how we arrived here, we need to understand something fundamental about the human body and the assumptions we make about it. The liver is arguably the most chemically sophisticated organ in the human body. It processes everything that enters your bloodstream. Every molecule of food, every sip of alcohol, every medication, every herbal compound, it all passes through the liver for evaluation, transformation, and clearance. The liver does not distinguish between a pharmaceutical synthesized in a laboratory and a botanical compound extracted from a plant. It sees chemistry. And some chemistry, regardless of its origin, is toxic. This is where the logic of natural equals safe begins to break down completely. Plants are not benign. They never evolved to be consumed by humans without consequence. Many plants produce chemical compounds specifically to deter consumption, alkaloids, glycosides, and phenolic compounds that can interfere with cellular function, disrupt enzyme activity, and in concentrated form, overwhelm the very organ systems trying to process them. When we take those plant compounds and concentrate them into capsule form, strip them of the fiber and water that would slow their absorption in a whole food, and then market them as a daily supplement to be taken in doses far exceeding anything a person would encounter in nature, we have created something that deserves far more scrutiny than it receives. And yet the regulatory environment in the United States, established primarily through the Dietary Supplement Health and Education Act of 1994, places the burden of proof not on manufacturers to demonstrate safety before a product reaches consumers, but on the Food and Drug Administration to prove harm after the fact. In practice, this means that products containing compounds with real, measurable biological activity enter the market with essentially no clinical vetting. By the time a safety signal emerges in the medical literature, hundreds of thousands of bottles may already be sold. Consider what this means for someone sitting across from their doctor with unexplained fatigue, yellowing skin, and liver enzymes so elevated they suggest acute hepatitis. The first questions a physician asks involve alcohol consumption and prescription medications. The question about supplements comes later, if at all. Patients frequently do not mention supplements because they do not consider them medicine. They are not drugs, they reason. They are natural. They bought them at a health food store. This gap in clinical communication has a name in the medical literature. It is called supplement-associated liver injury underreporting, and researchers believe it means the true scale of this problem is significantly larger than the numbers we already have. The demographics of who is affected challenge every assumption we might carry about who uses these products. Studies consistently show that herbal detox and cleanse products are most heavily marketed to, and purchased by, health-conscious adults, people who exercise regularly, eat thoughtfully, avoid processed food, and consider themselves informed consumers. These are not people making reckless health decisions. These are people who have been told, repeatedly and persuasively, that supporting their liver through periodic cleansing is a responsible, proactive act of self-care. The marketing is extraordinarily effective precisely because it speaks the language of wellness culture fluently. The concept of detoxification as it exists in the supplement industry bears almost no resemblance to detoxification as it exists in biochemistry. When physicians use the word detox, they are describing a specific clinical process, removing a specific, identified toxin from a specific patient, usually in a hospital setting. When a supplement label uses the word detox, it is invoking a vague, unverifiable concept of accumulated bodily impurity that the medical community does not recognize as a real physiological state. There is no credible scientific evidence that a healthy liver requires assistance from herbal capsules to do its job. The liver is not a filter that clogs. It is a dynamic, self-regulating organ. The idea that it periodically needs to be reset with botanical compounds is a marketing concept, not a medical one. But this is not simply a story about misleading language. It is a story about specific compounds, specific mechanisms, and specific patients who have suffered specific, sometimes irreversible harm. Among the most studied and most concerning are pyrrolizidine alkaloids, compounds found in dozens of plant species that have a particular and well-documented affinity for liver tissue. When metabolized, they produce reactive molecules that can bind to DNA, damage the cells lining the liver's blood vessels, and in sufficient quantities cause a condition called hepatic sinusoidal obstruction syndrome, a blockage of blood flow through the liver that can be fatal. Products containing comfrey, a plant used for centuries in traditional medicine and still available today in certain supplement formulations, have been associated with these injuries in clinical case reports spanning 5 decades. Then there are green tea extracts, which carry an almost universally positive public image and appear in an enormous number of detox and weight loss supplements. At the quantities present in a cup of tea, the compounds in green tea carry negligible risk for most people. Concentrated extracts, however, can deliver the equivalent of dozens of cups in a single dose, and epidemiological studies have identified them as one of the most commonly implicated ingredients in supplement-associated liver injury. The European Food Safety Authority has issued formal warnings. Cases of serious liver damage, including cases requiring transplantation, have been reported in otherwise healthy individuals who took green tea extract supplements for weight management. Kava, traditionally consumed as a ceremonial beverage in Pacific Island cultures, has been associated with liver toxicity severe enough to prompt outright bans in several European countries. Certain Ayurvedic formulations have been found to contain heavy metals including lead, mercury, and arsenic at levels that would be immediately actionable in any regulated food product. Black cohosh, marketed aggressively for menopausal symptom management, appears repeatedly in case series of idiosyncratic liver injury, reactions that cannot be predicted in advance and do not follow a simple dose-response pattern. And perhaps most alarmingly, products marketed as containing one ingredient have been found through independent laboratory testing to contain others, unlisted botanicals, undisclosed pharmaceutical compounds, and contaminants introduced during manufacturing. The regulatory gap is real. The chemistry is real. The patients are real. And the tragedy embedded in every one of these cases is that the harm was preventable, not because the products should necessarily have been banned, but because without adequate labeling, rigorous pre-market testing, and informed clinical conversations, consumers had no way to make genuinely informed decisions. They trusted a word. They trusted natural. And for some of them, that trust cost them their liver. The questions that follow from all of this are urgent and they are complicated. Which specific products carry the greatest risk? What does the science actually tell us about who is most vulnerable and why? What happens inside the liver at the cellular level when these compounds overwhelm its defenses? And what would a rational, evidence-based approach to supplement regulation actually look like in practice? The answers to those questions require us to go deeper, past the marketing, past the broad epidemiological numbers, and into the laboratories, the hospital wards, and the regulatory archives where the real story of how we got here, and where we go next, is waiting to be told. So we've established how the marketing machine works, and why so many people fall for it. But what happens inside the body when these products are actually consumed? What does the science really show when researchers pull back the curtain on ingredients that sound ancient and wise, but behave like something far more dangerous? Let's start with the liver, because that is almost always where this story ends. The liver is one of the most sophisticated chemical processing facilities in the known universe. Every second of every day, it filters approximately 1.5 liters of blood, neutralizes toxins, synthesizes proteins, regulates hormones, and produces bile to help digest fats. It does all of this silently, without complaint, and without any help from a 3-day juice cleanse. The liver doesn't need a supplement to do its job. What it does need is for us to stop poisoning it with supplements that claim to support it. Hepatotoxicity, the medical term for chemically induced liver damage, is now one of the fastest growing categories of liver injury in the United States and across Europe. And a disproportionate share of that damage is being caused not by alcohol, not by pharmaceutical drugs, but by herbal supplements. A landmark study published in the journal Hepatology found that herbal and dietary supplements now account for nearly 20% of all drug-induced liver injury cases in the United States. That number was around 7% just a decade earlier. It has almost tripled. What ingredients are driving this surge? Several keep appearing in the toxicology literature with alarming consistency. Kava, derived from the roots of a Pacific Island plant, has been linked to fulminant liver failure, a condition in which the liver shuts down so rapidly that patients can go from feeling mildly unwell to needing a transplant within days. Comfrey, often sold as a cleansing herb, contains pyrrolizidine alkaloids that accumulate quietly in liver cells and cause veno-occlusive disease, a condition where the tiny blood vessels inside the liver become blocked, destroying tissue from within. Green tea extract, which sounds almost impossibly harmless, has been documented in dozens of case reports as a cause of acute hepatitis. The extract form concentrates the catechins in green tea to levels that would be impossible to reach by simply drinking the beverage, and at those concentrations, something that is genuinely healthy becomes genuinely toxic. And then there is the ingredient combination problem, which researchers describe as one of the most underappreciated dangers in the supplement industry. Detox products rarely contain just one ingredient. They typically contain 8, 12, sometimes 20 or more botanical compounds, each one interacting with the others in ways that have never been formally tested. The human body was not designed to process that kind of botanical onslaught simultaneously, and the liver, which must metabolize all of it, can be overwhelmed. Doctors who treat supplement-related liver injury describe it as trying to diagnose a crime scene with too many suspects and no forensic database. The kidneys face their own quiet crisis. Aristolic acid, a compound found in several plants historically used in traditional medicine, is now classified as a Group 1 carcinogen by the International Agency for Research on Cancer. It causes a specific and irreversible form of kidney damage called aristolic acid nephropathy, in which the tubules of the kidney are systematically destroyed and replaced with scar tissue. Patients who consume products containing it may not notice symptoms for months or even years. By the time the damage becomes apparent, up to 50% of kidney function may already be permanently lost. And because the labeling of supplement ingredients is often imprecise, or because products are contaminated with plants that were never declared on the label, patients may not even know they consumed it. The heart is not spared either. Ephedra, the plant compound that was eventually banned in the United States after being linked to heart attacks, strokes, and at least 155 deaths, was for years marketed as a natural energy and weight loss supplement. The word natural appeared repeatedly in its advertising. It was, of course, derived from a plant. So is cyanide, which is found in apple seeds. The word natural, as any toxicologist will tell you, describes origin, not safety. Ephedra is no longer legally sold in the United States, but its chemical cousins are. Bitter orange extract, which contains synephrine, is now widely used as a replacement in detox and weight management supplements. The cardiovascular effects of synephrine are similar to those of ephedrine. Studies have linked high doses to elevated heart rate, increased blood pressure, and in rare cases, cardiac events. Yet because the regulatory ban was specific to ephedra, and because the supplement industry moves quickly when regulations close one door, bitter orange thrives on shelves today, often in products that also contain caffeine, which dramatically amplifies its cardiovascular effects. Now let us talk about what regulation actually looks like in this space, because the gap between what consumers assume and what actually exists is vast. In the United States, the Dietary Supplement Health and Education Act of 1994 fundamentally changed the legal landscape. Before a pharmaceutical drug can be sold, the manufacturer must demonstrate to the FDA that it is both safe and effective. For dietary supplements, the burden is reversed. The manufacturer does not have to prove safety before going to market. The FDA must prove harm after the fact. This means that by the time a supplement is pulled from shelves, the damage has already been done to real people. The system, by design, is reactive rather than protective. The European Union has stricter frameworks, particularly for traditional herbal medicines, but enforcement varies dramatically by country, and the online marketplace has made those borders largely irrelevant. A product manufactured in one country, sold through a website hosted in another, and shipped to a consumer in a third, can exist in a regulatory shadow that no single authority fully controls. Independent laboratory testing has revealed additional layers of the problem. Consumer Lab, an independent organization that tests supplements, has found that a significant percentage of herbal products either contain less of the active ingredient than advertised, contain more, contain contaminants including heavy metals and prescription drugs, or are contaminated with plants that were never listed on the label. These are not edge cases. These are systematic failures across a multi-billion-dollar industry that operates with minimal oversight and enormous financial incentive to keep it that way. What does all of this mean for the people who are actually harmed? It means a woman in her 30s taking a detox tea for 6 weeks develops jaundice and learns she has drug-induced liver injury. It means a man in his 50s using a kidney cleanse supplement loses a third of his renal function before anyone connects the cause to the product. It means emergency physicians across the country are seeing patients who are genuinely shocked, because they were doing something they believed was healthy, something that was described to them using words like purify and restore and renew, and they cannot reconcile those words with the machinery now failing inside them. There is something particularly cruel about this pattern. These are not reckless people. These are often cautious, health-conscious individuals who are trying to take care of themselves. They were trying to do the right thing. And the industry that sold them these products knew, or should have known, that the evidence base was thin, the safety data was incomplete, and the claims were constructed to persuade, not to inform. The human body is not a machine that accumulates grime and requires periodic flushing. It is a living system of extraordinary elegance, equipped with its own integrated detoxification infrastructure, refined over millions of years of evolution. The liver, the kidneys, the skin, the lungs, the lymphatic system, they work continuously, cooperatively, and with remarkable efficiency. They do not need assistance from a supplement. They need sleep, clean water, a balanced diet, and the absence of things that damage them, including, increasingly, the very products marketed in their name. Science does not offer a cleanser in a bottle. It offers something harder and more valuable, which is the truth. And the truth is that the detox supplement industry sells a story, not a solution. It sells the anxiety of modern life back to you in a package that promises relief, and in doing so, it harms the very organs it claims to heal. The next time you see the word detox on a label, remember what that word actually means to the scientists who study what happens after the bottle is opened. Remember the liver cases. Remember the kidney damage. Remember that natural is a description of where something comes from, not a promise of what it will do to you. Your body is already doing the work. The most powerful thing you can do is not interfere with it. Join us soon for another documentary.